Hello, in this recording, we'll be covering HIV and PrEP as part of Orange County Department of Health Sexual Health Coalition Education Series. HIV, or human immunodeficiency virus, is a virus that attacks the body's immune system and interferes with the body's ability to fight infection and disease. If HIV is left untreated, it can lead to AIDS, or acquired immunodeficiency syndrome. AIDS is the most severe stage of HIV infection. People with AIDS can have a high viral load and may easily transmit HIV to others. People with AIDS have badly damaged immune systems, so they are vulnerable to increasing number of opportunistic infections or other serious illnesses. Without treatment, people with AIDS typically survive for 3 years. In this slide, we have the most recent data for persons living with diagnosed HIV and AIDS in the state of New York. There is 105,610 people living with diagnosed HIV and AIDS in New York State as of December 2020. Symptoms of HIV and AIDS vary depending on the phase of infection. Some people infected by HIV develop a flu-like illness within 2 to 4 weeks after the virus enters the body. Possible signs and symptoms include fever, muscle aches and joint pain, rash, sore throat and painful mouth ulcers, swollen lymph glands mainly on the neck, fatigue, and chills. How is HIV transmitted? HIV can be transmitted through anal or vaginal sex. Anal sex is the riskiest type of sex for getting or transmitting HIV. Another way is sharing needles, syringes, or other drug injection equipment. The equipment may have someone else's blood on them, and blood can carry HIV. HIV can also be transmitted from mother to her baby during pregnancy, birth, or breastfeeding. Mother-to-child transmission is the most common way that children get HIV. Body fluids from a person who has HIV can transmit include semen, preseminal fluid, rectal fluids, vaginal fluids, and breast milk. These fluids must come in contact with the mucous membrane or damaged tissue or be directly injected into the bloodstream for transmission to occur. Mucous membranes are found inside the rectum, vagina, penis, and mouth. What increases the risk of transmitting HIV? One is a high viral load. The higher someone's viral load, the more likely that person is to transmit HIV. Viral load is the amount of HIV in the blood of someone who has HIV. Viral load is highest during the acute phase of HIV and without HIV treatment. Taking HIV medicine can make the viral load very low, so low that a test can't detect it. It's called an undetectable viral load. People with HIV who keep an undetectable viral load can live long, healthy lives. Having an undetectable viral load also helps preventing transmitting the HIV to others. 2. Other sexually transmitted diseases. If you have another sexually transmitted disease, you may be more likely to get or transmit HIV. Getting tested and treated for STDs can lower your chances of getting or transmitting HIV and other STDs. If you have HIV and get and keep an undetectable viral load, getting an STD does not appear to increase the risk of transmitting HIV, but STDs can cause other problems. Using condoms can reduce your chances of getting or transmitting STDs that can be transmitted through genital fluids, such as gonorrhea, chlamydia, and HIV. If you're sexually active, you and your partner should get tested for STDs, even if you do not have any symptoms. To get tested for HIV or other STDs, find a testing site near you. And 3 is alcohol and drug use. When you're drunk or high, you're more likely to engage in risky sexual behaviors like having sex without protection. Being drunk or high affects your ability to make safe choices. Drinking alcohol can alter your judgment, lower your inhibitions, and impair your decisions about sex or drug use. And you may be more likely to have unplanned sex, have a harder time using a condom the right way every time you have sex, have more sexual partners, or use other drugs. Counseling, medicine, and other methods are available to help you stop or cut down on drinking or using drugs. Talk with a counselor, doctor, or other healthcare provider about options that may be right for you. What are the stages of HIV? The first stage is called acute HIV infection, and this is often when people have a large amount of HIV in their blood and are very contagious. Many people have flu-like symptoms and others may experience no symptoms at all. However, if you have flu-like symptoms and think you may have been exposed to HIV, get tested. The second stage is chronic HIV infection. This stage is also called asymptomatic HIV infection or clinical latency. HIV is still active and continues to reproduce in the body. People may not have any symptoms or get sick during this phase but can transmit HIV. People who take HIV treatment as prescribed may never move into stage 3, which is AIDS. Without HIV treatment, this stage may last a decade or longer. At the end of the stage, the amount of HIV in the blood goes up and this person may move into stage 3. Stage 3 is acquired immunodeficiency syndrome, AIDS, which is the most severe stage of HIV infection. The CDC recommends everyone between the ages of 13 and 64 to get tested for HIV at least once. People with certain risk factors should get tested more than once. You should get tested at least once a year if you're a man who had sex with another man, you've had anal or vaginal sex with someone who had HIV, you've had more than one sex partner since your last HIV test, you've shared needles, syringes, or other drug injection equipment, you've exchanged sex for drugs or money, you've been diagnosed with or treated for another sexually transmitted disease, you've been diagnosed with or treated for hepatitis or tuberculosis, you've had sex with someone who had done anything listed above, or with someone whose sexual history you don't know. It's important before having sex for the first time with a new partner to talk about your sexual and drug use history. Disclose your HIV status and consider getting tested for HIV together. How to reduce the risk of transmitting HIV. U equals U means undetectable equals untransmittable, indicating that if a person with HIV is on HIV meds, the virus cannot be transmitted to a sex partner. If you are at risk for HIV, take medicine to prevent HIV called pre-exposure prophylaxis. Take antiretroviral medicine called post-exposure prophylaxis, or PEP, if you think you have been exposed to HIV in the last 72 hours and are not on PrEP. There are now more options than ever before to reduce the risk of acquiring or transmitting HIV. Using medicines to treat HIV, using medicines to prevent HIV, using condoms, having only low-risk sex, only having partners with the same HIV status, and not having sex can all effectively reduce risk. Some options are more effective than others. Combining prevention strategies may be even more effective, but in order for any option to work, it must be used correctly and consistently. What is PrEP? PrEP or pre-exposure prophylaxis is medicine that reduces your chances of getting HIV from sex or injection drug use. When taken as prescribed, PrEP is highly effective for preventing HIV. PrEP can be pills or shots. There are 2 pills approved for use as PrEP, Truvada and Descovy. Truvada is for people at risk through sex or injection drug use. Descovy is for people at risk through sex. Descovy is not for people assigned female at birth who are at risk for HIV through receptive vaginal sex. PrEP is safe, but some people experience side effects, so it's important to talk to your healthcare provider about your options. PrEP reduces the risk of getting HIV from sex by about 99% when taken as prescribed. Although there is less information about how effective PrEP pills are among people who inject drugs, we know that PrEP pills reduce the risk of getting HIV by at least 74% when taken as prescribed. Currently, PrEP shots are not recommended for people who inject drugs. PrEP is less effective when not taken as prescribed. Taking PrEP pills only when you are at risk for getting HIV is known as on-demand PrEP. It's also known as intermittent, non-daily, event-driven, or off-label PrEP use. On-demand PrEP is an option for you if you are a cisgender man who has sex with men, and you can predict when you will have sex at least 2 hours beforehand. With on-demand PrEP, you take 2 pills at least 2 to 24 hours before sex. Then you take 1 pill once a day for 2 days after you have sex. The only PrEP medication approved for on-demand use is Truvada. However, for cisgender women and cisgender men who have sex with women, people of trans experience, and people who share injection equipment should choose daily PrEP, not on-demand PrEP. PEP, or post-exposure prophylaxis, means taking medicine to prevent HIV after a possible exposure. PEP should be only used in emergency situations and should be started within 72 hours after recent possible exposure to HIV. Talk right away within 72 hours to your healthcare provider, an emergency room doctor, or an urgent care provider about PrEP if you think you've been recently been exposed to HIV. It is important to note that PrEP is not a substitute for regular use of HIV prevention. PrEP is not the right choice for people who have been exposed to HIV frequently. If you are at ongoing risk for HIV, such as going through repeated exposures to HIV, talk to your healthcare provider about PrEP, pre-exposure prophylaxis. There are three types of HIV tests: antibody tests, antigen antibody tests, and nucleic acid tests. Antibodies are produced by your immune system when you're exposed to viruses like HIV. Antigens are foreign substances that cause your immune systems to activate. If you have HIV, an antigen called P24 is produced even before antibodies develop. HIV tests are typically performed on blood or oral fluid. They may also be performed on urine. The first type of test that I'll be talking about is an antibody test. An antibody test looks for HIV antibodies in your blood or oral fluid. Most rapid tests and the only HIV self-tests approved by the U.S. Drug and Food Administration are antibody tests. Antibody tests that use blood from a vein can detect HIV sooner than tests done with blood from a finger stick or with oral fluid. It usually provides results in 30 minutes or less. The second type of test that I'll be talking about is antigen/antibody test that looks for both HIV antibodies and antigens. Antigen/antibody tests are recommended for testing done in labs and are common in the United States. This lab test involves drawing blood from a vein. There is also a rapid antigen/antibody test available that is done with blood from a finger stick, which takes about 30 minutes or less to provide results. The third type of test that I'll be talking about is a nucleic acid test, or NAT. A NAT looks for the actual virus in the blood. With a NAT, the healthcare provider will draw blood from your vein and send the sample to a lab for testing. This testing may take several days to provide results. This test can tell if a person has HIV or how much virus is present in the blood. A NAT can detect HIV sooner than other types of tests. This test should be considered for people who had a recent exposure or have early symptoms of HIV, who have tested negative with an antibody or antigen antibody test. There are also HIV self-tests that provide results within 20 minutes. Talk to your healthcare provider about what type of test is right for you. What does a positive HIV result mean? If you use any type of antibody test and have a positive result, you will need a follow-up test to confirm your results. If you test in a community program or take a HIV self-test and it's positive, you should go to a healthcare provider for follow-up testing. If you test in a healthcare setting or a lab and it's positive, the lab will conduct the following up testing, usually on the same blood sample as the first test. If the follow-up test is also positive, it means you have HIV. Receiving an HIV diagnosis can be life-changing. You may feel many emotions: sadness, hopelessness, or anger. Healthcare providers and social service providers can help you work through the early stages of your diagnosis. They can also help you find HIV care and treatment that will help you live a long, healthy life. What does a negative HIV result mean? A negative result doesn't necessarily mean that you don't have HIV. That's because of the window period, which is the time between HIV exposure and when a test can detect HIV in your body. If you get an HIV test after a potential HIV exposure and the result is negative, get tested again after the window period for the test you took. If you test again after the window period, have no possible HIV exposure during that time, and the result is negative, you do not have HIV. If you have certain risk factors, you should continue getting tested at least once a year. Taking an HIV test is not a way to find out if your partner has HIV. So be open with your partners and ask them to tell you their HIV status. But keep in mind that your partners may not know, may be wrong, or may not tell you about their HIV status. Consider getting tested together so you can both know your HIV status and take steps to keep yourselves healthy. HIV stigma is negative attitudes and beliefs about people with HIV. It is a prejudice that comes with labeling an individual as part of a group that is believed to be socially unacceptable. Some of these examples are believing that only certain groups of people can get HIV, making moral judgments about people who take steps to prevent HIV transmission, and feeling that people deserve to get HIV because of their choices. HIV stigma and discrimination affect the emotional well-being and mental health of people living with HIV. People living with HIV often internalize the stigma they experience and begin to develop a negative self image. They may fear that they will be discriminated against or judged negatively if their HIV status is revealed. Internalized stigma or self stigma happens when a person takes in the negative ideas and stereotypes about people living with HIV and starts to apply them to themselves. HIV internalized stigma can lead to feelings of shame, fear of disclosure, isolation, and despair. These feelings can keep people from getting tested and treated for HIV, so talking openly about HIV can help normalize the subject. It also provides opportunities to correct misconceptions and help others learn more about HIV. But be mindful how you talk about HIV and people living with HIV. We can all help end HIV stigma through our words and actions in our everyday lives. Lead others with your supportive behaviors. Thank you for listening to this presentation. If you have any questions, please send an email. And if you have any questions that you would like to be answered anonymously, please scan the QR code on the Sexual Health Coalition poster and it will take you to the Google form. Thank you.